welcome to Hospital for Special Surgery. As you may know, HSS has a long history of caring for infants, children, and adolescents with muscle, bone, and joint pain and disorders. At Hospital for Special Surgery, pediatric patients benefit from the knowledge and expertise of a multidisciplinary team. Chances are you may have met a number of these team members already through the course of your care to date. Now, as you prepare for your surgery, we wanted to give you a better sense of what you can expect during your stay with us. Preparing for surgery can be stressful. This short video is designed to help minimize some of that anxiety by providing you with a preview of the steps leading up to your surgery, an overview of what to expect on the day of surgery, and some helpful tips to guide you and your family through your stay. The video is meant to supplement the printed material you'll receive about your surgery. These instructions will also be verbally reinforced through conversations with members of your care team. While we hope that this video and other educational material will help address many of your questions and concerns, we encourage you to ask your care team any questions you may have. You'll have many opportunities to do so prior to your surgery and during your stay with us. We hope that you find this video helpful and informative, and thank you for choosing Hospital for Special Surgery. Prior to surgery, your surgeon may recommend an evaluation by one of our pediatricians and a team of nurses to help ensure that you're medically ready for surgery. A pediatrician is a physician who specializes in the medical care of children. These evaluations, also known as pre-surgical screening or pre-surgical clearance, are conducted in our pre-admission testing area. Your pre-surgical clearance appointment will be scheduled approximately 7 to 10 days before your surgery and will take place in an exam room on the 5th floor of the main hospital building in our pediatric outpatient wing. This is the same general area where you'll have met with your pediatric orthopedic surgeon during prior visits. During this visit, our pediatricians and nurses will perform a complete health history and physical exam. This exam will involve asking you questions about your medical and surgical history and performing a few basic physical evaluations, such as measuring your height, weight, temperature, heart rate, and blood pressure. In addition, our pediatricians and nurses will perform any lab work that may be required, and will review any relevant tests and specialist reports that may have been ordered, such as neurology, pulmonary, or cardiology tests. Finally, we'll review additional educational material related to your particular surgery. There are a few things you should remember to bring to your pre-surgical clearance appointment. These include a copy of your immunization record, a complete list of all prescription and non-prescription medication that you're taking, your completed preoperative registration forms, and any relevant medical documentation or notes from specialists that you've seen. Your pre-surgical clearance appointment may last up to 3 hours, so please plan accordingly and bring any items that may comfort you and keep you occupied during this appointment, such as your favorite book, music, or stuffed animal. You may also wish to bring snacks to eat, as long as you're not having surgery on the day of the pre-surgical clearance appointment. Most of our patients undergoing surgery are admitted to the hospital on the day of their surgery. This is referred to as same-day surgery, regardless of whether you'll be discharged on the day of surgery or are staying in the hospital afterwards. When you arrive at the hospital on the day of your surgery, you'll proceed to the same-day admissions unit located on the hospital's 4th floor. You'll then be escorted to an exam room called a holding room. This is the area where you'll be seen by members of your care team and prepped for your surgery. You'll be given a hospital gown to change into. Several members of the care team, including physicians and nurses, will be in to conduct examinations, take vital signs such as temperature, heart rate, and blood pressure, answer any questions you may have, and begin to clean the surgical site. The operating room or OR nurse may visit you in the holding room as you're being prepped for surgery to check in and answer any questions. The OR nurse works closely with your surgeon during the operation. He or she is responsible for monitoring you during surgery, maintaining a sterile environment in the OR, and coordinating care before, during, and after surgery. At this time, your surgeon will come in to review the procedure and answer any last-minute questions you may have. The anesthesiologist will also visit you in the holding room. The anesthesiologist is the physician responsible for administering the medications that will allow you to sleep during your surgery to ensure your safety and comfort. He or she will speak with you and your family about the anesthesia. Your nurse may apply a numbing cream to your hand or administer an oral sedative. The nurse may insert your intravenous or IV line. The IV will be the primary method by which pain medication will be administered during the surgery. Before you go into surgery, you may receive some medicine in your IV line to make you sleepy. Your parents will be with you in the holding room and typically are able to stay with you until your surgery is about to begin. Our staff will let your parents know when it's time to leave and will direct them to the family atrium where they'll wait during your surgery. The atrium is located just steps from the operating room and the recovery room where they'll be able to visit you after your surgery is over. From the holding room, you'll be wheeled into the operating room. It's possible that you may be asleep by the time you get to the OR, and most patients won't remember arriving there. The OR is a large open room with lots of equipment. When you're wheeled into this room, you'll be positioned and prepped for surgery. Your anesthesiologist will be with you in the OR and will continue to deliver pain medications. As your surgeon performs the operation, all of the OR staff, including the OR nurse, surgeon, and anesthesiologist, will closely be monitoring you. Your parents will be waiting for you in the family atrium. The family atrium provides a comfortable environment with a television, beverages, phone service, and internet access. The atrium staff will update them on the status of the surgery and provide support and information. When your surgery has been completed, the surgeon will come out to speak with your family. After surgery, you'll be brought to the recovery room, which is also known as the PACU, which stands for Post-Anesthesia Care Unit. This is where you'll slowly wake up from surgery. Your parents can visit you in the PACU. After your surgeon speaks to your family in the atrium, your parents will be escorted to the PACU to visit you. Typically, your parents will be with you in the PACU before you're fully awake. It's important for your recovery to have a family member nearby when you wake up from surgery. Your family member will receive specific instructions once in the PACU regarding touching, feeding, and waking you as you recover. You may have an oxygen mask on to help you as you wake up from anesthesia. You may feel a bit confused. You may not realize that you've had your operation. This feeling will go away as the medicine wears off. Your mouth may feel dry. It's okay to ask for a popsicle, ice chips, or a sip of something to drink. You may have pain from your surgery or an upset stomach from the anesthesia medication. Both can be helped by medicine in your IV. The nurses in the PACU will closely monitor you as you wake up and will be checking with you frequently to ask how you're feeling. For example, if you have any discomfort or feel nauseous or sick to your stomach. Once you've woken up and the anesthesiologist or your physician determines that your recovery is stabilized, you'll be transferred from the PACU to your inpatient hospital room. During your stay in the hospital, you'll be visited by members of the healthcare team, including your surgeon, pediatrician, nurse, physical therapist, and case manager. Each one plays an important role as you continue to recover in the hospital. Your surgeon will check on you periodically to see how you're feeling, see that your wound is healing, and address any questions. Your pediatrician, typically the same pediatrician who cleared you for surgery, will also be checking in on your progress and answering questions. From time to time, you may also be visited by a resident or a fellow. These are physicians who are receiving specialized training in orthopedic surgery who work closely with and under the supervision of your surgeon. You'll be cared for by a team of nurses during your stay. Your primary nurse is the nurse responsible for planning and coordinating your care while you're in your room. The nurse manager oversees the daily management of the unit that your room is on. You may also be visited by a nurse technician who will perform certain patient care duties under the supervision of the primary nurse and the nurse manager. There's also an advanced practice nurse who has advanced training and knowledge in pediatric orthopedics who will visit you during your stay. Your physical therapist will work along with your surgeon to create a personalized program of physical therapy exercises for you to do as a part of your recovery. Your therapist will show you these exercises while you're in the hospital, exercises that you'll continue to do after you go home. Your case manager will work with you and your family to develop a discharge plan and keep in regular contact with the insurance company. This team of care providers will work closely with you and your family to help make sure that you're as comfortable as possible. This includes managing your pain medication, developing a personalized rehabilitation program, and helping to prepare you and your family for a safe and comfortable discharge home. In addition, your room will have a call bell within your reach that you or your family can use to call the nurse if you need any immediate help or support in between these frequent visits by the team. Both of your parents are able to stay with you during the day, and one parent is able to spend the night in the room with you. Your friends and family may visit you during visiting hours. Food will be brought to you by a member of the food nutrition staff. One tray is provided for you, and one tray will be provided for a parent. You may also bring certain foods from home. Your family will have access to a kitchen pantry near your room. If you feel up to it, you'll be able to go to the activity room near your room where you can play with toys, video games, and use computers. Our Child Life staff helps oversee these activities and is available to provide emotional support to you and your family as you recover. If you'd rather stay in your room, that's okay too. We can bring them to you, or you're welcome to bring small toys, activities, or personal electronic equipment from home if you'd like. Social workers are also available to provide information and counseling to you and your family and assist with referrals to community resources. The length of your stay at the hospital will depend on the type of surgery you've had. Your surgeon, pediatrician, and the rest of the care team will help determine when you're ready to go home. Before you can be discharged, you'll have to meet the following requirements. Receive medical clearance from your surgeon and pediatrician, feel that you're relatively comfortable and that your pain is under control, and perform a set of physical therapy activities to ensure that you're ready to safely function in your home. Before you leave, you'll be provided with information about returning to school. You'll also receive all necessary prescriptions for home. And finally, you and your family will also be provided with customized written instructions that include information about precautions, home physical therapy exercises, and physician follow-up instructions. We hope that you found this video to be helpful as you prepare for your surgery. You may wish to view the video along with the written materials that have been provided as many times as you need to become more familiar with the process and the types of caregivers who will play a role in your treatment and recovery. You and your family should ask your care team as many questions as you need. The more prepared you feel for your surgery, the more you'll be able to focus on your healing during your stay with us and after you've returned home. On behalf of all of the staff here at Hospital for Special Surgery, thank you and best wishes.